Simply apologies, I interrupted you. So if you are still on the platform, please ask the question.
Yes, teacher.
And if Dr. Radha is not patiently, so I'll give it to you.
Thank you very much, Prof. Khan.
Hello, hi.
I'm Dr. Anton.
I know. I've been, last week I was in with your presentation. Yes, of course.
And well presented in layman's term. And I got two questions. One is, Menaca had already asked that, I typed it, to clarify that if there is a race against the virus, how many people can be vaccinated? And there are people who are COVID positive and people who have been ill with COVID, vaccinating them, can it be delayed from the time they got COVID positive? That way, we can give it to more vulnerable people without immunity and then come to cover them within 3 or 4 months of they becoming COVID positive is one of my questions.
I think there's a guideline, isn't it? Normally in our NHS setup, there's a guideline. I think if you had a COVID, you have to delay your vaccination for, I remember top of my head, 1 month or something.
Covered, is it?
Yeah, there's a guideline. 1 month you have to wait to get the vaccine. Yeah.
It is 28 days.
28 days, that's right. Yeah, we have a guideline for that.
Can't have it within 28.
Okay, the next question is, I came across that in South Africa, there is a surgeon who is sort of doing bronchoscopy and sucking out the mucus plugs, and the patients are feeling much better, able to breathe more. Have you come across anything like that? More robustly, what I came across is in YouTube.
I did not, but it makes sense because anyway there will be obstruction in the mucus plug and the patients are now struggling to breathe. Already the hemoglobin have been broken, because of the destruction of this hemoglobin pathway, and the oxygen carrying capacity is less. So if they take this mucus plug, definitely that will improve the breathing. That is a common sense. I don't think it's a big rocket science, and probably, but I did not read about that, but it makes sense for me.
Sure. Thank you, Dr.
I think Dr. Kanta will be more. Dr. Kanta will be more familiar with this because she is a geriatrician.
Also, I'm one of the COVID physician.
Mm-hmm.
One thing we do now, number of cases are very high. So that is done in the intensive care unit or high dependency unit when they go. What we do, give oxygen, antibiotics started, and dexamethasone given, steroid, and patients are moved quickly with oxygen requirement checked, and the concentration of oxygen changed time to time. We increase or low. If they become more than 15 liter oxygen, they have to go to CPAP. Sadly, 80 people over the 80 years still maintain on 15 liter in the geriatric wards, and I must say number of people dying in geriatric wards very high now. They're 80s. So, and the suction done in the intensive care unit when there are one-to-one care going to be given for younger, fitter people who have COVID. Sadly, it's a problem now managing the patients who really need oxygen. Emergency, what we give the treatment, basic treatment we are giving.
Yes.
Sure. Thank you, Dr. Kanta.
So now, can I ask you, Dr. Kanta, because for my understanding as well, this is a time for me to ask the question. So do you think maybe a few months ago you were managing the patient with intubation and all? Now after this understanding the pathophysiology now, we are moving towards the CPAP more now. Do you agree with that?
Exactly, yeah.
Good.
Yeah. Now all the people now see more CPAP machines are bought, more wards, more wards are open with CPAP facility. What they need is hyperbaric oxygen.
Exactly.
That's help. That is not needed. And people who feel short of breath at home have to come to hospital immediately.
Exactly.
That's all I say. I tell them.
That
Any
is
other symptom, even don't care. But breathing, come to hospital because they need oxygen. I saw a patient yesterday, they become confused. People have become confused when they lack oxygen.
Hypoxia.
They have to be brought up.
That's right.
Confused. Hypoxia.
Hypoxia will bring the confusion in 10 seconds. That's it.
Quickly, they become like a delirium. They develop delirium. So yeah, you are right. The way we are managing now is very different.
Completely
All
different.
different.
Thank you, Dr. Khan. Thank you, everyone. There is Raj Madhavan. I think you wanted to ask a question. There's a message for me. Is he still there on the platform? Raj Madhavan?
Yes, I have a question to Dr. Khan.
Yeah, please.
I'm Raj Madhavan from British Columbia, Canada. My first question is, you was talking about 150 days of immunity. Does this mean the immunity is when you get vaccine? So that means, is it even after getting vaccine, the immunity lasts only for 150 days? This is one of my first question.
Right, okay, so actually the 150 days I mentioned, after getting the COVID infection, if you develop any immunity, antibody immunity, that will last for 150 days. We don't know anything about the vaccine yet. So that has to be assessed in 3 months and 6 months and 12 months. That data will come probably next year.
Oh, okay, I got the answer. My second question, the last question is, people got disease even after vaccine. Does that mean they got it from the vaccine or they got it outside of the vaccine?
Very good. Okay, so at the moment, if you give 1 dose of vaccine and you are protected only 75%, in the layman term, if I want to explain, if you give the vaccine for 4 people and out of 4, 1 person still can get the disease, the COVID-19. They will get the infection and disease. We have to understand this one. Getting the infection is one, and getting the disease, that means complication and all the problems, is another one. So whoever get the vaccine, still the virus can enter to their body. Okay, they can get the infection, but still they will not get the disease because their immunity will fight with the virus and destroy the virus. Then after that, they'll come out of the problem. So now that 75% protection means, and if you take the 4 people and 3 will be protected completely and or maybe from the disease, but 1 person still have a chance to get the infection. That's what I said before. This is a common question. Recently, one of our nursing staff, after taking the vaccine, 3 weeks later, and she got the infection because she is unfortunately within that 25% area. So that's why they get that. That is not because of the vaccine. That is pure virus gave the infection.
Okay, thank you, Dr.
Not from the vaccine at all.
Answered my questions.
Thank you, Raj, and thank you, Naushad Khan. There's another question. There are plenty of questions for you. What age group? Can I just finish this question, please?
Yeah.
1 second. What age group mostly died in this current peak, and is there any specific age group who are more prone to this COVID?
I think I'm going to leave this question to Dr. Kanda because she is more appropriate than me because she is working in the ward, I'm working in the front line. We are in a different area.
Okay, fine. But I think,
Yeah.
It's affecting elderly people are more commonly affected from nursing. It's because low immunity, multiple problems, medical problems. But at the same time, I have seen people, I'm sorry to say anyone, I don't want to offend anyone, younger group patients who are coming, a lot of them are obese, overweight. Now we are seeing a bit of asthmatic patients as well. But one of the common, I think Dr. Khan will agree with me, weight is one of the major problems, is causing, because we are seeing people in that category more. Very overweight, morbid obesity and people like that. And but age group more. Now we are seeing over 60s, but a lot of elderly over. First wave we have a lot of over 80s. Now we are seeing a mixture, but still elderly people are dying more. That's I can.
I totally agree.
Thank you so much. Time for me to wear my exercise shoes and go and somebody.
I'm sorry to say, but today I got 2 patients in my ward, 44 years, women from Southeast Asian, both are quite obese, florid COVID. So then I thought it's very important we need to maintain. As Dr. Khan was saying, exercise is very,
Very important. Yes, of course.
Please walk.
both of you have inspired me to put my fresh shoes and go and do some exercise. Thank you. Krishna, over to you.
Hi, Dr. Naushad. Thank you for that. It's very clear. But I picked up on a little contradiction that I want to check with you. Because I work with people who might actually be in that same boat. And the contradiction is, when it came to taking the vaccine, we know at the moment, especially amongst ethnic groups, there are a lot of refusals or resistance. But when you were talking about the vaccine earlier, about yourself, you did say your wife had to tie you down before you agreed to take it.
Right.
And I'm just wondering if you can, I'm more interested in hearing what was
Okay.
your actual reservation.
Okay, I'll explain.
I think he said he doesn't like injections.
Yeah, okay, I'll explain that. So when I present, normally I want to keep the audience very focused towards me. Okay. So in this situation, really what happened, and for some reason I put this publication in my public page in the Facebook as well. We have a cellular immunity. We are Sri Lankans. I'm proud of it. So we have a BCG vaccine has been given for each and everyone in our country. Because of that, because of the cellular immunity, and we have an inbuilt immunity as well. Because of that, I survived for last 10 months, right? Then I told my wife, I survived up to this period. I was in the peak situation. I'm okay. Why? Shall I postpone this vaccine? Just for a fun, I asked her. Now vaccine has been arranged for me. You want me to take it? Really? You want me to take it? And she said, don't come home. Okay. Take the vaccine, because you are the man of the house, and also you must be protected, and you must be an example for other people. You have to take the vaccine and come. Then I was laughing. Okay, go and give the things. And but that lady also asked me, which hand are you going to go for? Do I have any choice? Go for whatever the hand you want. You put the things. That's what I said. But I don't like the needles for some reason. Otherwise, I totally support the vaccination. Totally support the vaccination. Yeah.
I agree, Dr. Khan. After 10 months exposure,
Here we go.
didn't-
That's the
Like
thing.
on June, when I went and checked antibody,
Mhm.
I never had symptoms. I never had swab positive, but I had antibodies.
You had antibody.
I had antibodies.
I don't
So
have
I-
antibody.
I-
I don't have a antigen. Both now, because my cellular immunity
I
probably.
don't know how antibodies came, but December, my son and daughter told me, if you don't take vaccine, we are not going to forgive you. You should take vaccine.
Here we go.
They
Same
were
situation.
worried. Because the second wave, they were worried the time I was working all the time. So I took the vaccine. And yesterday I had the second dose. I must say second dose more hand is painful today. But no other symptoms. I would say everybody take vaccine.
Sure. Yeah.
I had after 30 days.
Thank you, because I know like a couple of my friends who are doctors and dentists, they have taken the vaccination and they told the same. The second one was a bit more painful.
Yeah. The arms,
Yeah.
arm painful, that's all, the sight.
I'm too worried now.
The firm answer
Take
is
it.
Take
take
it.
the vaccine.
Take it.
Everybody-
That's it. Yeah.
Opportunity, take it.
Yeah.
Okay.
I also got the 2 dose. I'm okay. Perfect.
Yeah.
நான் கண்ட இன்பம் வையகம் பெறுக.
I am running.
It's just that
For people who don't talk Tamil, which means if I am going to be blessed with something, everybody else will be blessed with that. Yeah. Okay. Moving on. Are you finished, Chris?
yes.
Okay, fine. Because there are so many different questions coming through. I'm just trying to give everybody a chance to respond.
Sure.
Thank you so much. Oh yeah, of course.
Can I ask a question here?
Of course.
Yeah, I did type it. Now, despite all the treatment that have been offered, the death rate, daily rate, is very high.
Yeah.
So where are we failing?
I already seen the question. I about to answer that anyway. So it's a reasonable, very good question. infection rate is high because of the new variant. That is one reason, and because this is 75% faster than the previous one. So if you infect more, then the death rate also will be high. That is one thing. The second thing is, and the Christmas is one of the big celebration for the our UK setup, and there's no other festival. We have a multiple festivals, but here is one of the big festival. So somehow after 10 months, they managed to go to the family and they hugged each other, and they nicely spreaded the virus. The virus was waiting for that time, so the virus jumped up everywhere. So the rate of infection, now when was the Christmas? Now what is the time now? Probably now 2 weeks. So 2-3 weeks. So this is the time we will get the peak. That's why the number of infection is high. That's why the number of death is high. So, and on top of it, if you say there's another reason for that, in the Christmas time, they will meet? They will go and meet the grandparents. They will go and meet the mother, elderly mother or someone. All of them are very high risk population. They were keeping them in the sight. Now in the Christmas time, they met them, and then after that they spread it very fast. That's why the death rate is high. There are a number of reasons for that. Nothing.
But yesterday's news also said the substantial proportion is under 55. That is high.
Right.
That's what
Right. Okay.
First wave, Dorothy were 80 plus, so accepted the death rate. But now yesterday's news also said that.
1 minute. Compared to the previous virus infection, this new one is mortality rate less. Is it correct? Speed of infection is more, but mortality is less. Is it correct?
I won't say mortality less. No.
Okay, that's why I want.
They're very
Right.
different.
So
Is it similar to the previous one?
Yeah. Okay.
yeah, right. Okay. To answer that question, there are two-part questions in that. The first thing is that the 55 age, whatever. Now in this, there are patients presenting with a young age as well. Okay. That is true, but that does not mean young patients are more affected. No, it's not like that. Okay, that is not being said. But still, the elderly people and the high-risk people are getting affected more. That is one thing.
Sure.
The infectivity is fast, but mortality doesn't much change. So that's the current data we have. But still the research is going on. Is this virus more severe or then? But so far we don't have a clear data shows that mortality rate is high or the severe like that. So that is the we have to talk with the evidence. So that is the evidence we have.
Thank you, Dr. Khan. That's another question. There are a few questions. I'm trying to go through all of them.
This is a big area. You will have many questions. Please go for it. Yeah.
The way in the order what we came to this. As we are taking so many precautions against COVID, which illnesses that we normally see at this time of the year, are you not seeing as many cases of COVID?
Sorry, what is that?
So, in this time of the year, usually it's just during the Christmas time, we have a lot of flu, people come from influenza and stuff like that. Is it very different from that? Or is it a combination of COVID and those patients as well you're taking? Or is it predominantly COVID or predominantly other people?
Right. This is a common question they ask, but it's pretty obvious. We lost 2 million people in the world, right? So that is completely not normal. That is, we have to understand very clearly. The second thing is, yes, of course, every year there will be 500,000 people will die all over the world because of the flu. I agree. But this one is completely different. And you can see that. Now, every year, our emergency department and the acute medicine department and all and will be packed up. So normally that happens. Every year we have a crisis situation. Now, this is another on top of it, another load on top of it. That's why we are struggling at the moment. So obviously it's different, not the same.
Sure. Thank you so much. There's another question. If Sri Lankans have got BCG vaccination to protect from, and if you think it is protecting us to an extent from COVID, number of death rates, will they vary in our ethnicity?
Yes, I would say that. Number of, that means via BCG vaccine somehow playing a role, very important role in this COVID-19 situation. Because of the BCG vaccine, we have a better cellular immunity, right? Okay, let me put it this way. There's a type of cells, the T lymphocytes cells. And in that T lymphocytes, there are different types, CD4 and CD8 and cells. So one type of cell will memorize your whatever the infection come to your body. For some reason, there's a cross memory in this, but further research is necessary. But there are some papers have been published. So for the BCG vaccine, whoever had, they have some sort of a cellular immunity, and because of that, they are being protected more. That's why in Sri Lanka, if you see that, the number of death is very less in Sri Lanka. I think a total roughly around 200 odd patients died in Sri Lanka. And also naturally the environment also, they that also will give some protection. Day to day they get some sort of infections and all, that will develop their cellular immunity, and that also will give the protection. Definitely there is a different for the people who have taken the vaccines, the BCG vaccines. Yeah.
Okay. I'm going to ask a question which perhaps is closer to your heart. I don't know that it is anonymously being sent to me. Is there a special purpose for burning the dead bodies of people contracted to COVID-19 instead of burying? Because I know I haven't spoken to you about it, but I have seen your articles or posts about it. So is there someone asking the question?
Right. I have to give this answer very clear and precise. Otherwise, that will divert the things into other area. Okay. So, right. Whoever asked this, I thank you for asking that question. The WHO doesn't say you have to burn the body, because everybody have our own belief. For example, now in this panel, most of the people are the Hindus. So Hindus, they want to cremate the body. That is their belief. At the same time, there's so many Abrahamic religious people, including the Muslims and Jews and so many Christians, they want to bury the body. So that is their belief. My point is, we have to respect everybody's belief. That is the first point. The second point is, according to the WHO guideline, that does not say you have to cremate the body. That is the second point. So you can do both. The third point, there's no clear evidence. There's no evidence this will spread. When you bury the body, that will spread the virus through the water. There's no such a thing. So that is out of the question. But very important, and most of the people did not understand this point. I'm going to make it now. Probably make sure the internet connection is very clear. Otherwise, that half of the answer will bring up sort of problems. Most of the people did not understand the WHO guideline. That's a problem. Okay. According to the WHO guideline, there are some expectations. We have to make sure every single country in the world, they have to follow that expectation. For example, and your groundwater means this is not infecting the virus thing. The groundwater should be deep enough, and also from that the body burying area, and there are, I think, minimum 250 meters away from any drinking water. For example, the UK, have you seen any drinking water well somewhere? I never seen somebody drinking from the well. Okay, so we always drink the water from our tap, but in Sri Lanka the setup is different. So if you have that kind of setup, you have to follow that guideline from WHO, and also, and from that point, 500 meters, within that 500 meters, nobody can live. Nobody can live. So there are some guidelines. The government have the responsibility to maintain that guideline, and respect everybody's belief is really important. That is their responsibility. So they have to respond. They have to respect the people who want to bury the body, and they have to respect the people who want to cremate the body. So that is the answer for this. But you can bury the body. There's no question about it. Because of that, there will not be any problem at all. I believe I clearly answered that question. Otherwise, that will go all over the place.
Sure. Thank you so much. Okay. particularly if you are there, live telecasting on YouTube. Yes. Okay. Any other questions, please, from the audience? I think, sincere apologies if I have missed anyone's questions because there were plenty of questions.
I have one.
I will try that much.
Please,
Please,
yeah.
Swati. She's a question queen, so go on.
Dr. Khan, today I read the news that there have been 23 deaths in Norway, aged 80 years. They were all 80 years when they took the first shot of Pfizer vaccine. I do understand age has been a reason for that also, but I also want to understand when emergency approval was given to the vaccine, why the data is not being made public by the regulators.
Right, okay. That's a very good question. For some reason, I have seen the data.
Swati is a pharmaceutical scientist, so
Yeah, of course. So, fortunately, I have seen the data from the Pfizer. I have a full document. If you want, I can email to you, or I can send you. I have seen every page. So there's a big document around, I don't know, maybe 50, 70 pages or something like that. The point is, normal vaccines, they take around maybe a number of years, maybe minimum so far in the history, minimum number of years is 5 years. Okay. Now we have a situation, we have no other choice. So in this situation, we calculated the risk and we have taken the decision according to that. So, and in this situation, I would say it's a sensible decision to take that decision. And we don't have much data, means they have tested around 40,000 people, but normally, millions of people will be tested, So in this situation, they tested a reasonable number of people and different group of people, but they did not consider the pregnant mothers, they did not consider the children. So that's why they don't want to give the vaccine for them. So now they are giving. So maybe for another 1 year time, they will reassess the whatever the problems they come across and they will move forward. But so far, we can't guarantee this will give the protection completely. We have to wait and see. That is a summary.
Thank you, Swati. Thank you, Dr. Khan. Anyone else wants to ask a question?
It's a big area. I'm so glad because we did not talk about the virus, isn't it? We don't want to talk about it. There are so many PhD around, So we are discussing the outline or maybe surrounded problems. We are facing so many problems because of the COVID. That's what we are discussing here now. Sorry, I forgot to answer that question.
We are more interested in.
The Dr. Swati asked a question.
Yes, Vani. Yes, please.
Yeah, Dr. Naushad Khan, I've listened to so many of your speeches and you're really amazing. Now, it's about the viral load. I just want to know more about the viral load. When we talk about the normal days, say in 6 months, 7 months' time, is it safe to meet people outside in open area than in meeting people in the cinemas and stuff like that?
So sorry, let me clearly understand the question. So you're asking meeting the people outside what?
Yeah, in a park or anywhere. Is it better to meet them there rather than meeting in cinema?
Oh yes, of course, yeah. So right, when you are in the closed area, it's very easy to spread because if somebody cough or somebody when I talk and the small particles will be floating in the environment that can come to the next person. So because of that, the closed environment is favorable for the vaccine, viruses. So when you are in the outside, it's extremely unlikely to get the infection in the outside. So preferably outside. So that is the reality. And now, it's very difficult to, if you are in the park, get the infection from another person. It's extremely rare unless if the wind is towards you when they talk and that come to you in your face or something. It's a very rare situation. But otherwise, preferably outside. But how long are we going to continue this talking outside story? Huh? Okay.
Particularly in winter, it's hard.
Now we are moving to the era, and maybe in the dating side also. Before we ask the name, we're going to ask, have you been vaccinated? That kind of era we are moving now. Okay.
Prerequisites for dating.
run to live in the moon or another planets, you know.
Exactly.
Motion, that's what I wrote, typed it earlier.
Yeah.
Yeah, we have to contact Richard Branson for that. Thank you so much, Wadi. Thanks, Dr. Khan. It was an amazing presentation because I think it's a fun field as well.
It's a big area. It's a big area.
Right topic, otherwise. What I was trying to say before is because the reason I guess it's important to talk around the subject.
Around the subjects, that's right.
Virus itself, because that's what is the common man. I think that's what we are interested in. We are not going to do thesis on this virus. What we want to know is how it is going to affect our lives and our loved ones' lives, and how we can live with these things in the future.
Of course. Now, if you ask every member of this panel, and they will go through number of problems in their family. For example, now I will tell my situation, then you will feel the same way. I can't go and see my mother's funeral, and I did not go. Okay, I did not. One of my father's own brother died maybe a couple of weeks ago. I did not go. That is a simple. And also the number of people passed away in our family members and known friends and all. We couldn't visit. One element. The second thing is my son is in the medical school, and now most of the time he is like in front of the computer. You never seen the anatomy or whatever it is in the face to face. And probably I don't know when did he see his lecturer in the past. Okay, so that kind of era they are working around, and most of they don't even see their friends in the face to face. More they are in the that kind of scenario going through, and also and time to time they are closing the university and opening the university. See that situation, and we can't go. And when did we go for a holiday or something to stress ourselves? We did not go. And even for a small thing, so just we can't travel and see other family members who are living in the UK. So we are unable to see. So the number of problems we are going through every day somehow, right? And it's not an easy thing wearing the mask and go. People can tell simply. I can ask Kanta, and maybe we have a FFP3 mask that smell like a complete. I don't want to use that word in this panel. That smell like that word, okay? So I can't tolerate that smell. So how can you, and also when you wear the mask, that will make you like a suffocating the things, that will make you tired. When you come home, it's difficult. How long are we going to continue this kind of scenario? And also now my trainees are there, every 3-month rotation or maybe 6-month rotation, they are coming and going. Now when they come back, maybe another 2 years time, Mr. Khan, can I have maybe some reference? Who the hell are you? I've never seen her face. I've never seen the trainee's face. So this kind of practicality point of view, so many problems all of us are facing in a different way. So that's what we have to talk about. We don't want to talk about the COVID vaccine, the virus or whatever it is here.
I mean, like exams are cancelled,
Exactly. A-level exam. There's no A-level exam. How accurate is that?
And now they're saying they will have mini exams. So we don't even still know whether there are no exams or exam. It's not even clear yet.
What is that mini? It's like an iPhone, maybe like a mini phone and the bigger version and the pro version like that. What is that mini thing?
Yeah, because they're saying there has to be a public exam. So there's a thought now. They might keep a mini exam, not the full version of exams like you explained here.
So now I really appreciate in this panel there are different people have a different skills. They are specialized in a different area. For example, last week I was with Dr. Anton and he was presenting there's a mental health related things. So the different way that Dr. Kanda is working with the elderly people. So we don't need to talk about the virus. So we have so many other problems. We are not expert. Everyone is not expert in that. So we have to understand other side of the problems around us. And we have to move forward. We are not going to get rid of this virus. This virus is going to live with us for a long time. That's the reality. We have to understand this. So then somehow we have to find a solution and move forward. I think I observed one of my father's brother is here, the Akbar Ali, and I did the 2 weeks ago his own brother passed away. my father's own brother, I couldn't go and see. That's the reality now we are living. You know, how are we going to move forward? So, sometime, go ahead.
Thank you so much for telling that, because I think we were, Dr. Anupama spoke about mental well-being, but this situation is definitely not helping the mental well-being of anyone right now.
Can I mention something, Menaca?
Of course.
Yeah.
Yes.
Basically, we have to prepare ourselves mentally.
Exactly.
Compared to us, there are so many people worse off than us.
Yes.
Say, look at African country, in Sri Lanka and India. People are poor, they are living under the bridge, and no place to live except one room for maybe 5 or 10 people. We have the Zoom, we have the MST, and food is available, and there are people who have been taken as prisoners of war. They have stayed there for years in one cell. Can't we stay in our house and in the back garden? We have to see people who are worse off than us, for us, rather than looking at, oh dear, we can't go on a holiday and we can't talk to the front door neighbor. But that will come. I'm sure soon they'll allow us to talk to the front door neighbors.
It is said that being alone is different from being lonely. So we have being used to being alone, but it shouldn't be lonely because there's access through internet and other things, isn't it? But people didn't know this difference.
Thank God the Zoom and MST
Can I also make a comment? I see some elderly people coming to hospital now. They don't want to go home. One of my patients told me, Doctor, if you discharge me, my daughter locked me in a room, I will commit suicide. So then the ward sister referred her to psychiatrist. It's a Sri Lankan patient. I went and met and talked. What is your problem? Doctor, I used to go to temple every week. Everything I was doing. Now my daughter has told you can't go anywhere. So the mental impact of social isolation in older people actually worse. All the younger ones using Zoom, phone and everything. The only thing she enjoyed, going to the temple, going to the shop, sit there. Everything stopped now. And daughter and mother started fighting. Only daughter. So many years they lived. Now she said, my son-in-law doesn't want to see me because she used to come to the sitting room to watch the television. Now he's working from home, it seems. He's an accountant. So he has told after 5 only you can come to the sitting room. So the fight between the never had now. So these are the social problems we are facing. I felt we have to think how we can. Then I had a long discussion with the family, and finally they agreed to put a television network into a room and a new TV.
And the smartphone would do.
Actually, you should have done it long ago because the mother should at least something.
I should say a smartphone also would do the trick.
Yes, exactly. But since close when they come,